Hello, I'm Giulia, and my project focuses on preclinical RA. RA is an autoimmune disease that usually manifests around 40 to 50 years of age. The first manifestations are joint stiffness, swelling, and pain. RA is classified as seropositive in presence of circulating autoantibodies. Preclinical RA identifies the asymptomatic phase that precedes clinical manifestations. This phase can last years, sometimes it never progresses to RA, and is hard to detect. In particular, we study B-cell and autoantibodies activity. We explore the possibility of preventing RA progression in the preclinical phase. The presence of circulating autoantibodies, such as ASPA or RF, is a risk factor useful to identify patients. There are two ways to approach this research question: through laboratory experiments and clinical studies. Experiments are done on B cells, isolated from the blood of RA patients. We aim to characterize B-cell clones that express ASPA on their surface. Once we have a better understanding of the physiology of those cells, we will use them to test inhibitory compounds that might be useful for RA treatment. The second approach is to do a clinical study, like the ongoing observational study that follows up at-risk individuals. Patients are asked to fill in a questionnaire on their health and lifestyle. During the visit, joints are also examined to check for RA progression. Patients are followed up for 5 years, after which they are considered as not progressing towards RA. In case of interventional study, patients are given an intervention, which effect is evaluated over a period of time. Interventional studies on preclinical RA are ongoing, but their actuation is complex. We plan to start a small pilot study to evaluate the efficacy of promising compounds. Preventing or slowing down RA onset will decrease the burden that RA has on the individual and society.